coming up the steps right now. So you've got your 2 o'clock keynote right now. Hello, how are you? Fabulous, fabulous. It's a good day. We're in the cloud, so we can serve it. We can serve the whole country.
You can talk to somebody in 45 seconds.
Yes, yes, that's it. Yes.
See, I retained
Yes.
You're
good.
Okay,
Can we
so
take a picture?
sure, I can get Victoria.
Awesome. Thank you so much.
Thanks for putting this on.
This is awesome.
Great.
Awesome.
Good. I'm glad you guys are
Thank
pleased
you.
with it.
No,
It's
we
quite an
appreciate
effort for you to come.
So important, especially for real population. Even the underserved, inner city media, we want to be able to reach out to.
They're not as mobile either as people assume. That's true. They probably have better service there.
Better broadband.
Yeah. Well, thank you so much for coming.
Thank you very much. Thank you.
All right.
Over here, they're doing a live out right now. They're
Oh,
going to show
okay.
you.
Hey. Nice to see you.
Yes, thanks for coming by.
You're at the apartment. So,
It's a live stream of a patient in Northwest Arkansas. That's the fetus through the backbone.
Sorry.
Making the connection. Right there in the head. See the head through round?
yes. Yeah.
And
How
then-
old is that? How many weeks? Do you know?
I would say around 30.
Yeah, pretty. So you're the OBGYN?
Yes?
Yeah, because you know Dr. Chambers.
Yeah.
Yeah.
He trained me.
He was my OBGYN at one
He
point.
was a good surgeon, let me tell you. He taught me techniques. He was very gentle with patients. To this day, he would surprise me with that.
He's still living.
Oh yeah, I thought he died.
No. He's about 90.
Yeah, he was a great guy. He was a very classy.
We know his son is John
Yeah.
Chambers. Okay, so you're looking at that.
The patient's actually up there in the corner of the bar.
Okay.
So,
Is that the technician I'm looking at or the doctor?
Well, Rosalind is the nurse.
Okay.
And like the high-risk OB nurse.
Right.
And genetic counselor's there.
Okay.
And we're there. We're the doctor. So we're watching. See, when we do these consults, I would think about I'll watch this. One counselor will talk to that patient. And then Rosalind handles the similar traffic. That's the little animal. Yeah, the baby's moving.
Just move.
Oh, it did. I don't know if it's closed or not. We don't have live.
So are you doing this in other states? Or other states too?
Not so much OB yet. We probably led the nation. I just go get the movie after we started in 2003. And we do as many of these every day as we do live. So we do about 2,500 of these every year. We do about 25 live. We basically replace that. It's a heart to heart.
I'm back on this. They didn't do this tonight.
Yeah, well, but it's the future. You don't have enough.
So do you pick up early stuff or mid stuff or got issues or whatever?
Yeah, we saw something wrong.
Yeah.
We would bring them down to the school, and then we see them more in depth. And then if we these nurses are for doctors, we just see the red flow. That's the one. So then we follow. peripherally. So we don't keep them at the school. We manage them when they're not in.
He's not the microphone guy, right?
So it's made it
He's not a microphone guy. The blue mics. So right at the beginning.
There he is.
Let me give you one of these. Get your stats. This has all the programs. So we expanded from this to include many other aspects of health because it's a plug and play model in the school and you can we talked to the West Virginia guys just
Yeah,
a little while ago.
yeah, from CANC. Well, thank you. I think I'm getting the hook here.
Yeah.
I just want to introduce you to some
Our friend Dan Diamond.
Yeah, thank you for working with this. This has been fantastic. Thank you. Yeah, there's lots of really exciting things going on. Well, good. I hope all the presenters are feeling good about it.
I am too.
Yeah.
I think so. I think they're just really good.
Right. And meet all these different people from around the country. So I'm introducing you, I guess. Okay. I'm going to speak and introduce you, and then probably have to flow down. I don't know. Yeah. Sure. Hello. Well, good afternoon to everybody. I know that Senator King was just here, and Senator Klobuchar was here earlier, and Senator Heitkamp and I are here together. We've worked on several issues together, but I can tell you this is probably one of the most important things that we can and should and will do as members of the Senate, not just for all of you in the room, but for all of those folks back home who have issues. I would first like to thank the American Telemedicine Association and Dr. Sabrina Smith, who will be following me after I make brief remarks. But thank you, Dr. Smith, for your help. And again, thank all of you, the presenters who I got to meet a little bit earlier, for all of what you're doing. This has been a great partnership. I should have started out like I was going to start out, and I forgot, because I always like to start out sort of light-handedly. But I've been going around today saying to everybody, gee, let's talk about health care, because that's all. But this health care I am very excited to be talking about, particularly with the Broadband Caucus co-chairs, who I named. We've worked on a lot of different ways that delivering broadband service in your state, how it can help the quality of life of all the folks that you live around, whether it's economic development, whether it's agriculture, whether it's tourism, education. But telehealth, to me, is the one where I think really holds great promise, particularly somebody who's from an aging state that doesn't have the access that a lot of other states and other folks do. So I'm really pleased to do it. Unfortunately, in West Virginia, 1/3 of our state does not have adequate broadband, and we're hoping, we just talked about this, that the force of telemedicine is going to propel our providers and our innovators to figure out the way to get that last third of our states and my state connected. I'd like to give a shout out to CAMC. There they are. Thank you. I did their screening, their eye screening it might have been almost as much as a year ago. Because in West Virginia, we have a lot of people who have limited ophthalmologists in and around their communities. But we have one of the highest rate of diabetes in our country. And we found that statistically that 26% of the patients with type 1 diabetes and 36% with type 2 have never had their eyes examined. And not being a physician, but knowing that there's a big correlation between eye health and diabetes, that's exceedingly important. So I want to thank CAMC for traveling over the mountain and coming to represent us so well, as they always do. So I'm just really excited to see the different technologies. What's really amazing to me in the room is how the technologies are different. It's not like we're all going in the same direction or we're all kind of trying to jump over one another. I think what we're trying to do is hit the spots that are important for our states or for our regions, but this is all can be used, globally, internationally, but particularly nationally. And so we're going to have a full plate, I think, of options and range of options as we watch the technology change. So I will turn the floor over to Dr. Sabrina Smith. And again, thank you. She and her group have been very instrumental in getting many of you here, and I appreciate that. And Senator Heitkamp, you will be next. Thank you.
Well, thank you very much, Senator Capito, for those very kind remarks. I'm Sabrina Smith, and I am the interim CEO for the American Telemedicine Association. And it is an absolute pleasure to be here today to partner with the U.S. Broadband Caucus on this very, very important issue. So let me start out telling you a little bit about ATA, and I won't go into a lot of depth, but I do want to hit the high points. So ATA has over about 10,000 members representing 450 organizations. That includes medical centers, hospitals, integrated healthcare systems, clinics, standalone medical technology companies, medical societies, government, and the list goes on. And I think Senator Capito really highlighted that there's a lot of diversity and complexity with telehealth, but it's wonderful because we're not all doing the same thing, but we're all going in the same direction. So at ATA, our overall mission really is to promote and champion the full integration of telehealth into the healthcare delivery system. We strongly believe that it's going to provide access, quality, and it's going to be affordable. So we champion that, we're working toward it, and we realize that there's some policy issues that we have to address, but we are moving forward. But let me share with you some statistics, because every time I hear these statistics, it just blows my mind. In 2013, there was a report that went to Congress from the Department of Health and Human Services, and it highlighted that $9.6 billion was going toward telehealth services, and that includes remote monitoring and some other aspects. And that was a 60% increase from the year before. So that's interesting. And then 60% of our hospitals and healthcare institutions are providing some form of telehealth. 40 to 50% of the hospitals as well. So healthcare institutions as well as hospitals. So let's fast forward to the end of 2017, and it's predicted that over $46 billion will go toward telehealth. $1 billion. So as you can see, that innovation and the market are advancing. But our policies and our regulatory framework are not advancing as quickly. And so again, those are areas where we need to work together to ensure that we do have policies that support this wonderful innovation that we know can provide access to patients. Senator Capito made the comment that broadband was more than an economic issue, that it touched on other issues such as education and health care. And we couldn't agree more. We feel that they're totally an overlap between broadband and telehealth, because we cannot deliver these life-saving and life-changing technologies without high-speed internet. We need the broadband. I was actually very surprised when I came in, and that was the first time that I had actually seen that map of the United States with all of the blue. There was absolutely a lot of blue. And it's important to, I think, for all of us to remember that when we look at that blue, that we're really talking about communities, we're talking about people that need to have access to quality health care. So I think there's an opportunity for us to work together to address these challenges, and we're looking forward to doing so and working with all of you. And again, I want to thank all of the sponsors that showed up today to really demonstrate what we can do in telehealth. And this is just a few of them. I mean, there are lots of different innovations that are happening that we know are going to improve the quality of health care that we provide. So I won't take too much time, because I do want to introduce Senator Heidi Heitkamp. And she is definitely a champion for access in her own area in North Dakota. She realizes that this could have a significant impact on the communities that she serves to provide them local access to hospitals and clinics. So without further ado, I'd like to turn over the podium to Senator Heitkamp.
Thank you so much, Dr. It is really great to be here with my partner in crime, Shelley Capito, who I met first on the softball field. She's a lot better than I am. Yeah, you are. Anyway, but she is somebody who wants to innovate, wants to solve the problems that we have today in a different way. And so when you walk around this room, what you see are Ferraris. That's great. You guys are doing incredible work. You're innovating. You're creating incredible products. But you don't have a road to drive them on, where we need that road. And that's why Shelley and I have teamed up under her leadership on the Broadband Caucus. We're in a little better shape in North Dakota with broadband than they are in West Virginia. That's a product of really a lot of commitment over the years. Telemedicine isn't anything new to North Dakota. We were talking about telemedicine back in the 90s. We were talking about Ivan and delivering education services remotely back in the 90s. Quentin Burdick, before he passed on, was one of the leaders in this area, bringing broadband and bringing access to this kind of data and communications. So North Dakota's been at this a long time. You might say, why? Because we need to be. We are remote. And we have a population frequently in rural areas where people can't afford the gas to get to the clinic. They can't afford to travel. They don't have the means to get from point A to point B. And when you don't have the means to actually travel, how do you get your health care? I mean, it is really that simple. There is no way, especially in Native communities, many times people go untreated. So maybe untreated diabetes gets worse and worse, and we see amputations, we see blindness, we see consequences as a result of not getting that treatment on the front end. And guess what happens? Healthcare costs go up. Because we don't have that preventative care, we don't have that immediate diagnosis, we don't have the opportunity to advance healthcare, wellness, the way we need to. So it's our job in Congress to figure out how we are going to build the highway. Now, I will tell you, you don't frequently get an opportunity to come in front of the President of the United States, and usually you savor up your one or two issues. And I will tell you that the champion in the room, last time we were at lunch with the President, was Shelley Capito, who when it came to be her turn to get that little morsel out there, it was rural broadband. And so do not underestimate the huge commitment that we're making here and the discussion that we're making here. We can get this done. So it's not enough to build the highway. We have to lower the regulatory barriers and the payment barriers to delivering health care in new ways, right? So it's like we can build all this technology, But if no one's going to pay for it, and if it doesn't qualify for reimbursement under Medicare or Medicaid, if it's not something that can be deployable in Indian communities, it's academic. It doesn't have a consequence to the patient, which is what we're really trying to get at. I want to give a shout out to Good Sam. Last time they were in, we talked about long-term care and the transition. Long-term care, when, in our minds, was you go there and you don't come out, right? That's not true anymore. It's used on rehabilitation. And if we want less expensive care, we know we need to deliver that care at home. We need to do the monitoring at home. And they have a whole system that they're now developing to provide that service to a patient, so we aren't basically putting our loved ones in an institution before they need to be in an institution. We can deliver health care at their home. Now, here's the other bit of good news. When we started in the 90s, we had a whole bunch of population that had never used technology. Think about that. But, I studied, when I went to law school, I used technology, this kind of thing that you use today in word searches. And so I'm in my 60s, which means that when people say people won't use it, they won't like it, they want to be in a doctor's office, there is a whole sea change and a transition that you're seeing. And even with our veterans who now have access to treatment for post-traumatic stress because of telemedicine, they enjoy it. I ask them frequently, these 80-year-old guys, what was that like? He goes, I just held up my hand and I said, look at that. And they diagnosed it and I got a salve and it took care of my skin condition. And and it meant they didn't have to go all the way 100 miles away to the next CBOC or to the VA clinic. So think about how critically important it is that you guys continue to innovate, and how critically important it is that we address two issues. Number one, building you the road so that you can actually deliver the health care in communities and states like North Dakota and West Virginia and Alaska. But the other thing is to tear down the bias and the barriers in reimbursement so that you can, in fact, be assured, if you're going to invest in this kind of work, that investment will pay off and you'll be able to deliver a high-quality service, but also be reimbursed for the patient care that you're providing. So thank you all for a chance to talk about these issues. Thank you all for the work that you do. We'll continue to make this the highest priority. And, Shelley made a joke about, we want to talk about anything but health care. I will tell you this. People used to ask me what my position was on Obamacare. And I would say, I'll talk about the Affordable Care Act, but can we talk about health care first? And people kind of look at me like, what is the difference? And I go, we need to talk about health care. So maybe now our opportunity is to transition from talking about reimbursements and who pays for it, and talk about that quality of delivery and the new innovations that we can bring that will improve patient health, that will lower costs, and at the end of the day will meet the needs of the people in rural states as well as urban states to fulfill our commitment to making sure that we have affordable, reliable health care in this country for every citizen. Thank you so much.